Violence against healthcare workers is a harrowing issue, affecting the very foundation of public health systems worldwide. Understanding the epidemiology of this violence reveals a concerning trend. Healthcare professionals are at an elevated risk, particularly in emergency departments and conflict zones. This distressingly common phenomenon requires immediate attention to assure the safety of those dedicated to saving lives. When a young woman died in Foggia, Italy, around 50 of her enraged friends and relatives decided to punish the healthcare workers they deemed responsible. A video circulating online, showing doctors and nurses barricaded in a room trying to protect themselves from this fury, brings the debate on violence in healthcare to a new level. The crisis is no longer limited to out-of-control psychiatric patients or individual patients or family members losing their temper during difficult moments. An attack like the one in Foggia requires premeditation, especially because the triggering event, a surgical intervention that ended tragically, occurred at the end of a long hospitalization, treatment, and rehabilitation process, not during an emergency. Despite the potential for human error in the operating room, which the prosecutor's office is investigating, nothing, not even the worst case of malpractice, can justify such an assault. Nor can we get used to violence as if it were an inescapable professional risk associated with hospital work, especially in emergency departments. In 2023, 16,000 assaults were recorded in Italian hospitals, according to a union of Italian doctors and healthcare managers. One-third of these assaults were physical, and 70% of them were directed against women. In August, acts of violence were reported more than once a day in Italy. According to an investigation conducted region by region, the problem of violence against healthcare professionals extends beyond national borders. According to the World Health Organization, WHO, 8% to 38% of healthcare workers worldwide suffer at least one physical attack during their careers. There are no reliable statistics about verbal attacks, which are often not reported. These attacks are sometimes intimidating and can have significant and lasting psychological effects. The WHO's attention has shifted in recent years, especially to the unacceptable threats to the lives of healthcare workers in war situations or other serious emergencies. These threats clearly have other causes and require different solutions. The latest documents related to workplace safety in ordinary situations date back to the early 2000s. In many ways, it was a different world compared with that of today. Real-life examples illustrate the extent of this crisis in various contexts. In the USA, reports of assaults on emergency room staff have surged in recent years, prompting discussions about the need for security reforms and enhanced staff protection measures. For instance, states have introduced legislation to classify assaults on healthcare workers as felonies, aiming to deter potential offenders. These measures reflect a growing acknowledgement that healthcare facilities must be safe havens, not battlegrounds. In Europe, the situation is similarly alarming. A survey conducted across several countries revealed that a significant percentage of healthcare workers have experienced some form of violence at work. The European Union has initiated campaigns to raise awareness and promote policies addressing workplace aggression. France, for example, has implemented training programs for staff on conflict de-escalation techniques, equipping them with skills to prevent violence before it occurs. Such proactive approaches are crucial in cultivating a culture where healthcare providers can perform their vital duties without fear. The global perspective on this issue further broadens the conversation. In regions plagued by war and instability, healthcare workers often face unimaginable risks. In places like Syria, attacks on hospitals have become systematic, highlighting the need for international humanitarian laws to protect medical facilities and their personnel. Combating violence against healthcare workers is not merely an issue of legal measures, it is also about fostering a culture of respect and safety within healthcare settings. Educational initiatives aimed at both healthcare professionals and patients are essential to reshape perceptions about violence. Encouraging open dialogues about the emotional toll of aggression on healthcare workers can lead to greater empathy and understanding. As communities rally around the shared goal of safeguarding their healthcare providers, it becomes clear that addressing this issue requires collective action at local, national, and international levels. Together, we can pave the way for a future where healthcare professionals are free to do their work without the shadow of violence looming over them.